The COVID-19 pandemic affected people at all stages of life, from seniors to newborns. It has hampered our health systems to a major extent. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about 5 new insights into the COVID-19 pandemic's effects on eating and health. New studies presented at the Nutrition 2022 examine the causes and the effects of COVID-19 related food insecurity, how the pandemic affected breastfeeding practices, and many more. Firstly, if I talk about the internet access and food security in older adults. In a new study, the researchers sought to find out how technology use and access to internet are related to food security at risk. The analysis revealed that food insecurity in the older age group during the COVID-19 pandemic was associated with poorer social and mental well-being and even less access to the internet. These findings did suggest that technology access should be considered when developing interventions to address food insecurity for elderly population. Next is the breastfeeding experiences during stay-at-home orders. The investigators explored how the COVID-19 pandemic may have impacted the mother's role and breastfeeding practices. The survey results revealed that some mothers found that the extra time at home facilitated a bond much better between them and their baby, resulting in breastfeeding which is longer than eventually planned. However, many mothers even reported that the COVID-19 pandemic was very stressful, and in some cases, mothers even reported low milk supply due to that amount of stress. The next insight that is given is giving birth during the pandemic. The researchers assessed anxiety, confusion, and breastfeeding self-efficacy. All these a mother's perception of her ability to breastfeed among the mothers who gave birth during the pandemic. The researchers did find that mothers in the study were able to maintain planned infant feeding decisions and retained high breastfeeding self-efficacy despite the continuing COVID-19 pandemic. Then is the food insecurity and distress around managing diabetes. The researchers analyzed associations between food insecurity and diabetes distress related to COVID-19 in adults with pre-diabetes or undergoing a diabetes condition. The study was based on a national web-based survey administered to low-income adults. Diabetes distress was measured by assessing the emotional burden, physician-related distress, self-management related distress, and even the interpersonal distress. Based on these findings, the researchers said that the healthcare providers should screen for diabetes distress and also connect patients to resources to help manage food and mental health needs. Lastly is the vitamin A levels in hospitalized COVID-19 patients. Vitamin A plays a key role in regulating the immune system, development of lung tissue, and even repair of infection-related damage. Now, to better understand its potential role in COVID-19, the researchers compared vitamin A blood plasma levels in critically ill and those recovering with COVID-19. They found that those who were critically ill patients in the acute phase of COVID-19, they showed significant decrease in the total vitamin A as well as the RBP bound levels compared to patients who were still recovering. So, to summarize, all these 5 aspects detailed how COVID-19 pandemic affected our health. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.